It is very important that we see development as a human development. It's not that we should have tall buildings. It's not that we should have only nice roads on which we can travel. It is above all that we develop the human beings. And if we are going to develop human beings, it is logical that we see development as starting with what we do with the children as they are born. It is through vaccines that we have been able to protect the health of the child.
What you see in immunization is very simply prevention. When children are immunized, they don't get sick. When they don't get sick, they don't spread the disease to others. These investments in immunization, which sometimes can cost as little as under $20 a year, can protect a child and a population for years.
Immunising children, protecting them from preventable diseases, I think that's incredibly important. And there's a lot of children and women out there that aren't getting the benefits of these services. We've got a huge geographical area with very few people in it. The topography is difficult to navigate, the road infrastructure is lacking. And often people really don't have very regular or frequent contact with the health facilities.
People have to walk long distances to go to the health facility, and it's not easy. So when the mother is bringing those children for health services, she might not be able to carry 2-3 children because she has to walk long distances.
Zambia is a huge, expansive country, such that in certain places you may not actually have, say, electricity. So the sort of cold chain equipment you use has to be tailored to that local context.
When we are going to conduct these outreach activities, we make sure that we carry enough ice packs so that we maintain the cold chain. Most of the health centers are run by just maybe one nurse only, but for a center to run, you need about 3 trained staff.
You may actually appreciate that it's quite a challenge to ensure that vaccines are delivered in the remotest parts of Zambia to these women and children.
In our program on vaccination, it has become very apparent that it is the one area we would never have succeeded without partner support. And so here we have a situation where we accept responsibility for the core support of the programs, but also appreciate very much the support that we are getting from our partners.
Immunizations are important for the development of Zambia. I'll give an example of myself. I have a big scar here, which was given to me when I was in primary school for smallpox. Now it's a history. My children, my grandchildren will not know of smallpox because it has been eradicated.
It's not going to happen overnight. But by having a strong partnership with a country like Zambia, a country that's on a strong democratic path, we really can reach that point eventually where we're beyond assistance. And that's what we're looking forward to.
As the motto says, children are our responsibility. All of us, we are very much responsible for the children. So as you may be aware, these children are the future leaders. These are the future presidents, the future pastors. So we make sure that these children, they grow very healthy and provide positively to the running of Zambia as a country.